So welcome everybody to our first year anniversary. How exciting. For those of you who are just joining us, and there are some new faces, welcome, welcome. Great to see some familiar faces back again as well. I've already said this has been recorded, so as I've said, if you want to turn your camera off, please do carry on. Say hello in the chat. Just be aware that when I'm presenting, I can't see the chat. So if it's a burning question for me, just speak out. I don't mind being interrupted. But if you're just saying hello, then I will ignore the little things that keep popping up on my screen. Right, let's see if my slides will work. Hurrah. Okay, so we've got a jam-packed agenda. For those of you who have come to my events before, this is how it happens. I always put far too many people on and we run out of time towards the end, but let's hope we can get through it all. So I'm really pleased to be here to welcome you all in and talk a little bit about what the cluster's been up to for the last year and touch upon where we might go from here. But that is all a collaborative process of where we go from here, and that's why you've been invited today. I'm then going to hand over to Tom from CGI. CGI, as you know, are the cluster partners. We are super pleased to announce that they are back on board, partnering with the cluster for another year. So that's fantastic. And Tom is going to talk about their vision for establishing the Northeast as a leader in health tech. We are then going to hear from Graham Evans from NEX. He is here representing the Northeast and North Cumbria Integrated Care System Digital Strategy Group, and he's going to talk about that strategy and what that means for industry in the region. I'll then hand over to Mark David from the Northeast Satellite Applications Centre for Excellence. He's going to talk about the link between space technology and the healthcare sector. We then welcome Kirsty Yates from County Durham and Darlington NHS Trust, who is going to share a sprout of an idea with us. Following that, we've got Andy Morrison, who is from the Great North Air Ambulance Service, who is going to talk about how they've been harnessing innovative technology within their charity. And then finally, a last minute addition to the agenda, how could we leave out the wonderful Jo York from Ignite? She's going to be talking about opportunities for any tech startups that we've got in the room through their accelerator and pre-accelerator program. And then, as I said, it's over to you. We want to hear from you where you think the focus for the next 12 months should sit with the cluster, how you want to get involved. And that's, as I say, that's really key for progressing the cluster forward and ensuring that we're delivering the kind of activity that is useful to you guys. So over to me. So we started this cluster a little over a year ago now. From nothing. We just noticed that there was lots of Dynamo members working in the health tech space, new members, and then around the same time, the LEP had started a steering group with various stakeholders in the region that was focusing on health tech as one of their health and life science priority areas. So that's how it all started from the ground up, and it's my pleasure to kind of talk to you now about what we've been through over the last 12 months or so. So in order to try and make sense of the healthcare technology landscape in the region, we produced this horrible infographic that demonstrates just how complicated it is. So our first priority was to engage with these organizations to talk about what we wanted to achieve. And over the last year, we've done that. So we've engaged with around 40 SMEs. The ones that you see on this screen are the ones that we started with, but that's grown and grown. Most of the NHS Foundation trusts, the local authorities, healthcare partner organisations, local universities and colleges. We've forged really strong partnerships with the likes of the AHSN, working collaboratively to support organisations working in the health tech space. And these kind of partnerships just continue to develop and grow, as does our network, both regionally and nationally. We now regularly meet up with the Northwest cluster based in Daresbury, the Harwell cluster based in Oxford, and most recently we've joined forces with the Leeds-based cluster to explore opportunities for collaboration and networking across our organisations and regions. And we've even promoted the cluster internationally at a Department of International Trade event to US-based health tech startups as to why they should relocate to this hotbed of activity that we have here in the Northeast. And I thought it was a good idea at this point to kind of reflect back on those original cluster aims and see just how much we've achieved. So this is what we planned to do originally. And, to connect organizations across the sector, to champion and shout about what's happening in the region. Well, I've just described how we're already doing that. To scope the sector needs, to develop projects that match clinicians' needs with the tech specialisms that we have in the region. And you'll hear more from Kirsty on that later on. So events, we've had 25 events, 53 speakers, 807 attendees, and 1,200 minutes of content over the last 12 months. So we've been busy. And of course, I've just talked about the ever-growing network. And we also regularly share projects and funding opportunities via regular email updates, which I know you all await in your inbox with bated breath. So at our launch event last September, we worked with some of you that are in the room today to identify the key focus areas for the first 12 months. And I'm pleased to say that we've been developing projects and activities across all of these areas. So we delivered a showcase automation event back in October last year. Our first big event was CGI, and that's now going to be one of the first work streams that the steering group developed, of which I'll talk more about later. CGI and Word Nerds also conducted a social listening exercise using AI to deliver insights about what real patients were saying within maternity and mental health pathways over social media, with the ultimate goal of positively transforming the patient experience. So these findings were presented in a patient experience event with speakers from across health and social care in February, and that project continues to attract attention from different specialist areas within the NHS who are keen to use the tech. We delivered a 3-part programme of activity on population health, starting at VentureFest back in March to a design sprint led by CGI in May and culminating in a pitching event at the Dynamo conference in June. And I'm super pleased to say that directly from that activity, one of the businesses secured interest from a national healthcare organisation on their product. So that success demonstrates the power of the cluster, even at this early stage, and its potential to have a positive impact on the economic growth of the sector. And we've also made significant progress aligning the cluster with our NHS colleagues through the North East and North Cumbria Integrated Care System Digital Strategy Group, of which you will hear more from Graham. So we'll be working with the trusts over the coming 12 months to identify unmet needs, to ensure that opportunities are being developed for and with our regional businesses. So to the future, what about the next 12 months? Well, some of the areas of interest we think we can get some traction are through that ICS Digital Strategy Group to start. I mean, our membership brings a unique insight into the needs of the ICS. By working together with this group, we'll encourage a buy local mindset when thinking about digital solutions, which boost the regional economy, resulting in new products, services, jobs across the SME landscape, firmly placing the Northeast as a hotbed of innovation in health tech. The group are really engaged and keen to work with us. And as I said, Graham is going to talk more about that in a moment. The Association of Directors of Adult Social Services is also another area of interest for us. I recently spoke to the regional group about that, who were keen again to start working with local industry to identify unmet needs and work collaboratively on solutions. It's early stage discussions, but hopefully should reap similar rewards to the work that we're doing with the ICS, but this time specifically in social care. And I mentioned steering group work streams earlier. These areas have been identified by the group as high growth potential areas in the region. So the work streams are just being formulated now. So it's an ideal time for anybody who's interested here today to get involved and to be there at the start to help shape what that delivery will look like. The work streams that have been identified so far are immersive technology, AI and automation, population health, and digital inclusion. of which the AHSN are already launching some fantastic work on that final one there. And finally, we want to hear from you. As I've said at the start of the event, we want to co-create the activity that we deliver with you, the people and organisations in this room who actually make up the cluster, and to ensure that we're doing all we can to support you. So now let's move on to some of those opportunities that we've uncovered, hear from some of the partners that we've mentioned. And I'd just like to say at this point, without the support from CGI, we wouldn't have been able to achieve all that we have achieved. So I'd like to take the opportunity to thank them. And I'm going to hand over to our first speaker, Tom Adams from CGI. Unless anybody has any questions. Sorry, I should have asked that first, Tom, before you started sharing your screen. If you have, put them in the chat. Tom, over to you.
Thank you very much, Emma. I'm delighted to be here once again talking with the Dynamo Northeast Health Cluster, and also delighted to confirm that CGI is sponsoring the cluster for a further year. So I'm sure we're going to do great things together over the coming 12 months. So I'd just like to remind people about CGI. So we were founded 45 years ago. We've got a global presence, but I think what's really important here is that we're very locally focused. We'll talk about that in a bit more detail as we go through this presentation. We have a real culture of ownership and accountability. So we're a bit like the John Lewis of IT companies, where all of our colleagues and staff are members of the company. We're also really focused on client satisfaction. So that's a major part of what we do. So we're constantly in touch with our clients to understand what their pressures are, to really get some feedback about how we're doing and what we need to do to help our clients be successful in terms of delivering their own businesses. So what do we do? So we're really based on strategic IT and business consulting, as you've seen from some of our work with the health cluster. We are a major systems integrator, so one of the big 5 systems integrators globally. And we also offer managed IT services. And one of the key things that we do is, obviously we have our own IP, but we work extensively with partners to bring the right solutions to local organizations to deliver their outcomes. And key to this is what we call our client proximity model, otherwise known as a metro model within CGI. And that's really important, because that's all about building local client relationships, understanding the local context. So in the Northeast example, that's understanding what's going on across health, social care, the academic networks, and really focusing our delivery on that local context. With that in mind, we can also bring to bear some of our global capability. And we're increasingly seeing this in health and social care. How can we bring some of the solutions from other sectors into the health and social care space, whether that's AI or robotic process automation? And I think on the seminar we had earlier this year, in terms of patient experience, how can we bring some of that customer experience into health and social care? So we do a lot of that, and we can talk about how those solutions can fit with the local context. Moving on, one of the important things that we do is what we call the voice of the client. So we look at what the business priorities are for our clients every year. And we also look at the technology implications of those business priorities. And I've got a couple of slides here to really show what's happening in terms of the prioritization of objectives and outcomes for health and social care clients. And I think the most important thing here is number 4 on the list, where we're seeing the improvement to customer experience has gone from 4th place to first place in the last 2 years. And we'll talk about the reasons for that in a moment, but it's primarily about how we can engage not only patients but citizens in that whole journey through wellness, periods of ill health, and supporting people to live independently at home for as long as possible. So that's really been a focus of what we've been looking at in response to the voice of our clients. And that's reflected again in terms of IT priorities. So again, we can see number 2 on this list, improving patient experience by digitising and automating healthcare, going from second place to first place. And I think also importantly, and this was the subject of one of the seminars, how can we get better insights and intelligence from data to support the planning of new models of care and new services in health and social care. So in terms of the Northeast context, this is just a slide showing some of our clients across the North. So we have, if you like, these metro models in Manchester, Liverpool, Newcastle and Leeds. And all of this is about understanding that local context, working with SMEs, supporting local development. So how can we help the Northeast really become, you know, a leader in terms of health and social care, technology and the delivery of services to citizens in the Northeast? And one thing that we could potentially look at would be becoming a whole system demonstrator in line with the NHS's new approach to set up these whole system demonstrators to really highlight best practice in the delivery of health and social care going forwards. So I think this slide is just showing the current challenges in health and social care. All of this will be familiar to people on this call. So the biggest single issue at the moment is the big backlog caused as a result of the pandemic. So how can we reduce that backlog? How can we support staff who have had a really difficult time over the last 18 months through workforce solutions? How can we redesign services that can absorb some of the increasing demand from an aging population? And of course, an aging population brings with it the probability that people are going to be living with long-term conditions for longer. How can we better integrate health and social care? And again, we've seen a focus on this in terms of government policy. Obviously, the funding issue is paramount in terms of enabling this, but there are solutions out there which we can adopt that smooth those processes of referral, reablement and ongoing support. And obviously we need to do this within a framework of financial and operational pressures. And then bottom right, last but not least, how can we better support personalised healthcare? So encouraging people to look after their own health and well-being, supporting people through technology to live independently at home, providing tools so that that circle of care can be involved in that patient support, and improving the experience of patients and citizens going forwards. What does this mean in technology terms? So digital transformation is often talked about, and it's really that magic triangle, isn't it, of people, process and technology. So we want to avoid just putting solutions out there, point solutions, without that service transformation wrap and the ability to support all of that new technology at scale. We need to look at interoperability, and we're going to hear from Graham in a bit around the whole interoperability agenda across the Northeast and the Great North Care Records. How can we change culture? How can we get better insights from data to understand what's happening in real time? One of the key challenges around technology in healthcare is that you can be swamped by the amount of data. So what we need to do is provide what we call actionable insights, so that the services can respond to the patients with the highest need as efficiently as possible. And obviously we need to wrap all of that around with the appropriate security and governance, and provide staff with the right employee experience. So that's the right information in the right place at the right time, every time, but ensuring that the workforce has the appropriate skills and training and support in order to deliver that technology successfully. So CGI is working in this space with a number of clients across local government and healthcare. And again, it's all about this support for a population through wellness, through periods of illness, and then back into support at home. So really, how can we channel shift services to be delivered at home as far as possible? Because obviously that supports a more cost-efficient model of care going forwards. So we're working on various solutions in this space with a range of different partners, and we can explore some of those solutions over the next 12 months. But obviously we would bear in mind what's happening in the Northeast in terms of your existing solution landscape and your local SMEs that you want to bring to the table in terms of delivering some of these services going forwards. So the overall vision, which we could look at in the Dynamo context, is how can we improve patient outcomes, support the regional integrated care system, and drive towards a population health approach. And that obviously can involve managed IT, it can provide a range of different transformation services, and that's based on IP that we could develop jointly, whether that's intelligent automation stuff, RPA stuff, patient-facing applications, working with partner solutions and SMEs in the Northeast. And together, all of this will help to address some of those themes that we talked about earlier. So better integration of health and care, supporting smart and healthy communities across the Northeast, getting a better patient experience, that magic phrase, how do we give patients and citizens the Amazon experience equivalent in health and social care? How do we provide the right technology in people's homes or in care homes to enable remote patient monitoring? Right the way through to designing and implementing digital hospitals, which work on the basis of technology rather than it just being an add-on. And last but not least, digitally enabling the workforce. So with that in mind, really look forward to working with the cluster over the next 12 months around these themes. And these themes are at the heart of everything the Northeast is doing through the strategic transformation partnerships and the integrated care systems, of which we'll hear from Graham in a few minutes. So thank you very much.
Thanks, Tom. Great overview from CGI there. And as I said, really super happy that they're back on board to partner the cluster and we can do more great things over the next 12 months. So we'll now move on to Graham Evans, who is not from NEXT. He is from the North Tees and Hartlepool NHS Trust. So many acronyms in this game. And Graham is here in his role as part of the North East and North Cumbria Integrated Care System Digital Strategy Group. And so I will hand over to Graham.
Thank you, Emma. And just to confirm, can colleagues see my screen before I progress?
Yep.
Wonderful. Thank you. So thank you for the introduction. And I think Tom has set me up very nicely in terms of some of my overview. For those of you that are not aware, the North East and North Cumbria Integrated Care System is the largest integrated care system in England. Second, the nearest rival, I would suggest, would be the Greater Manchester ICS, who has a similar population. Our population is 3.2 million citizens, but clearly our geographic footprint stretches from the west coast, the southern border of Scotland down to the North Yorkshire border and across to the east coast of the country. So we've got a very large geography to contend with. In terms of our original digital strategy for the integrated care system, originally we had 6 priority work streams, very much about improving population health and preventing ill health, as we heard from Tom. A bit of a catch-all, which is around how we optimize health services through high quality care delivered through a whole range of programs, mental health and learning disabilities. But what I would suggest were two enabling rather than sort of delivery work streams are around workforce transformation and last but no means least, digital transformation. We published our first strategy in 2019. The intent was to have a 5-year vision for integrated health and care. But then very quickly, we were hit with this thing called the pandemic, along with a couple of other policy changes around the long-term plan and people plan for the NHS. And that prompted us to develop a new strategy. Our strategy can be found on the ICS website. The URL is there. It's very much about a bit of co-produced work. So it was one of the first strategies within the ICS that we developed in partnership with our local authority colleagues, and we had input from many other stakeholders. The document is a very light read. It's about 30 pages long. It's PDF with a dynamic navigation. It talks about our national drivers, our national context, where we need to head and why. It describes our vision around providing high quality, easy accessible and efficient healthcare services to the people and population of the North East and North Cumbria, delivered through digital solutions. So it's very ambitious in its description. It also talks about the whole range of stakeholders that we had during the second iteration of this strategy. And clearly we did this new version at the peak of the pandemic, and we used virtual communication platforms such as Teams, etc., to bring in a wide range of views, thoughts and input. So we really did lead by example by using technology to really promote and deliver at pace a new and hopefully inspirational vision for the future. We have 5 key themes. It's very much about getting the essentials right, making sure that we've got basic infrastructure. We do have an ethos in our part of the world of continuous improvement, but ultimately, and by definition, an integrated care system is about connecting. We also want to make sure that we learn. So every time we do something, can we learn as a system and feed that learning back in to what we do and how we do it. Last but by no means least, it's about empowerment. How do we empower staff? How do we empower citizens? And I use that phrase deliberately. And then ultimately, how do we empower patients and the population? For each of those sections, the document describes what we intend to do, our plan, but also we do a little bit of a reflection about what we've already done. I was pleased to hear Tom mention people, process and technology, because this isn't just about tech. This is about transformation of health and care, using technology where it's necessary and appropriate, but on occasion, technology isn't the answer. There may be a simple process change that drives a more improved delivery outcome. We've also had a very rigorous overview of our digital governance and accountability over the last 12 months. We now have some new processes in place, but conscious that we are now in the midst of a redesign of integrated care systems. From April 22, the ICS will become a legal and statutory body. It'll probably be renamed as an integrated care board. So we are working through a design framework at the moment. And from a digital perspective, another NHS acronym, What Good Looks Like, is a framework to identify how you can deliver transformed health and care through technology deployment, but also good governance. And there's a process that we're currently going through, which I'll touch on shortly, on the arrangements that we're trying to provide there. We do have a roadmap. It seems very similar to the roadmap that Tom previously described. We have done a lot of stuff already, but there's clearly lots more to do, and I'll touch on some of those opportunities shortly. Keeping our eye on the future, the world of technology is changing at a rate of knots. A lot of this has been driven by the miniaturization of technology. Clearly now there's more computing power on a person's wristwatch than perhaps there was on the Apollo 11 moon mission. So technology is moving so fast. What's an idea today will be certainly a reality tomorrow, but the day after it may be out of date. But we do want to move towards a world of digital by default, but we do need those solid foundations in place on which to build. Our strategy is an iterative document. We expect it to change over time, but what we also want to do is to bring in some supporting strategies from other areas such as our population health teams, our primary care groups, and also our membership of provider organisations, for example, North Tees and Hartlepool, as you can see in this illustration. And by doing that, we keep the document real, we keep it live, but we also keep it vibrant and iterative, and we can develop changes and iterations pretty much on the fly. In terms of the NHS long-term and people plans that I already mentioned, the key drivers that were articulated in those documents about providing digital first access to primary care, how we can reduce or produce digital models to reduce outpatient footfall. Could we use video consultations as an example? What could we do to deliver a digital front door experience? And we've, in this part of the region, chosen to use the NHS app as our digital front door. And how could we promote and deliver greater self-care, allowing citizens and patients to be in more control of their own health and care agenda? On the flip side, we wanted to level up the amount of digital inequality or maturity in some of our provider organisations. How could we build privacy and security by design? And how could we create the concept of a shared care record across the health and care continuum? We are very fortunate in our part of the world that we do have quite a lot of highly digitally mature NHS providers, some of which would be likened to be in the Premiership. We've got quite a number that could be in the Football League Championship, but conversely, we've got several that are in the Whitby and District Sunday League. So we do need to level up, and the real reason for that is an integrated care system will only be as good as the weakest link, and therefore it's really incumbent to get those organisations to a level of maturity to allow them to participate in the whole interoperability agenda. For the eagle-eyed people amongst you, you will have noticed the red asterisks on some of these deliverables. Many of those have been delivered as a consequence of rapid adoption of technology driven through the last 18 months of our response to COVID. But what we've learned also, whilst the technology does provide a whole range of digital tools that helped during the pandemic, it's also created some other considerations. So it is now a time for reflection. Not everybody wants or can interact with digital services. So we do need to consider digital exclusion, digital equality, and patient and citizen choice as we progress. We have a whole range of strategic digital programs, our crown jewels, if you will. They're all centered around the patient and citizen. The Great North Care Record being probably the most well-known of those programs. Three key components within that program of work: the integration of all of our points of care through a health information exchange, that's essentially digital glue. The creation of a patient engagement platform to allow patients and citizens to interact with their own health and care agenda. And then the development of a trusted research environment, which I'll talk about in a second or two. In addition, and under the Optimising Health Services workstream, we're delivering a whole range of transformation products and services, particularly in the diagnostic space around radiology, pathology and haematology, and many more will follow suit. We have a really ambitious programme of work to develop digital care pathways through an organisation that 7 of our regional providers have collaborated to create, called NHS Health Call. And this has created and has helped tremendously during the pandemic to speed up digital adoption and access parts of our system that traditionally would be left wanting, such as care homes. We're also in the early stages of doing a regional collaboration to join up some of our pathology services with a common laboratory information management programme. And there are many, many others, such as anticipatory care programmes, community diagnostic programmes, and maternity programmes to deliver patient-held maternity records. So there's a whole smorgasbord of things occurring in the region, which makes this a very exciting place to be. And we've also provided some tactical and strategic oversight during the COVID pandemic to make sure that there were no unintended consequences of planned changes because of our dependency on our partner organisations. If organisations were planning to do an upgrade of a technology, we've put some risk management services in place to do a root and branch review to ensure that you don't inadvertently affect one of your neighbours or other service providers. So that's provided a real oversight of how we work together as a system. I'm not going to go through the following slides in any great detail, but essentially these are many of the deliverables in each of those programmes of work. This one, for example, in the GP and primary care space, massive amounts of work that have been delivered, certainly within the last 18 months. Great North Care Record, as I've already mentioned, the real change process now is how we've accessed or given access to over 3 million views of the Health Information Exchange across our health and care system. And there's a whole range of new pipelines of work that are in train, particularly access via the NHS app, that will be a transformative step in the way we integrate health and care across our health and care communities. I've touched on this very briefly, but our Trusted Research and Evaluation Environment, or TREE, is in a mature stage now of strategic development. We've had a number of governance approvals so far, but there will be a clear link between the TREE, population health, and long-term academic research. What we want to create is a method and an environment that we can use to access data securely, legitimately, and appropriately to improve the long-term health outcomes of our communities and populations. From a digital diagnostics point of view, a whole range of programs around interoperability of our pathology services, radiology, hematology, and endoscopy. And again, just some brief headlines of the key deliverables so far. A very ambitious program of work, perhaps groundbreaking in many of its respects, because we are truly now bringing together common infrastructure, common services to support the patients and citizens of our population. Lots and lots of fantastic work through our Academic Health Science Network colleagues. This particular series of programs has brought in a lot of external funding and really speeded up our transformation and innovation agenda. Lots of great examples here. And I do think some of these deliverables, there's a massive opportunity in the future for our industry partners to help us move even further, even faster. I've already touched on Health Call, just a few examples of the areas in which Health Call is really transforming our health and care agenda, using those technology solutions and sharing good practice across the entire region and beyond. So this is, again, like the Great North Care Record, one of the jewels in our crown within the regional digital transformation programme. And I've touched on this briefly, but in essence, what we're now looking at is this What Good Looks Like programme to help us move forward across the system and nationally. So there are essentially 7 success measures of what good looks like. It's a bit like a quality assessment. Are you being well led? Do you have the smart foundations? Do you promote and deliver safe practice? Do you support people? Do you empower citizens? Can you improve care? And can you deliver healthy populations? So what we're doing at the moment, we're looking at this at both a system and individual organisation level. We have a rigorous assessment and a template that each of our member organisations are going through. And as a system, we're providing an overarching assessment. The assessment is very simple. It has a grading structure of 0 to 5, 5 being good. And for each of those 7 areas, we will rate our own internal performance. What we then expect to have is a bit of a heat map, which identifies the things that we're doing well, the things that we need to do a little bit better at. And from that, we'll create a gap analysis and a further iteration of our strategy to allow us to move a bit further and a bit faster. So our strategy is all about delivery. There's no point talking about it. We need to turn words into actions. Data does allow us, on occasion, those actionable insights that Tom referred to, but there are some unintended consequences. We are now clearly a target for cyber criminals, and we have a clear and present danger around cyber threats. We do need to make sure that we don't inadvertently exclude massive parts of our population and our staff. So digital exclusion is a consideration. We are delivering the next stages of the ICS design framework, and that also includes what good looks like. But clearly, the message, which is loud and clear, is that digital is not an option, it is a necessity. And what I'd like to do now is just give a 2 or 3 minute video.
In the North East and North Cumbria, all the local NHS, local authorities, health and care professionals are working together to improve the overall health for the 3.2 million people who live here. By working as a region, we can use digital technology to make things better for the people we care for. We have already introduced lots of new technology, which improves the way staff can access information or the way that people can interact with health and care services. Much has been accelerated in response to the COVID-19 pandemic. By working together and developing a range of digital solutions, we can better communicate with staff and patients, which has been vital as we have responded to the pandemic. There are lots of digital ambitions set out in the NHS's long-term plan. Many have been achieved, but we still have work to do. So what might it look like in the future? Your health and care records will be shared immediately with frontline staff involved in your care, using the Great North Care Record. You will have access to your Great North Care Record so you can manage your appointments and care. We want to bring more services such as pharmacists and care homes into the Great North Care Record because they are also involved in your care. Digital images and results will be shared across the region so that no matter where you go for care, they can be shared safely and securely. We will enable our staff to work flexibly across different places and organisations. All of our health and care organisations have different amounts of electronic or paper records. We want to help those who still rely on paper to move to digital records. This helps us share more information quickly and between different organisations. We are guarding our systems and keeping them safe from cyber attacks. We've worked together to implement a regional cyber response. We can use data that is recorded in our region in new ways. By analysing activity across the region, we can spot trends and even begin to make predictions about where care is needed most. We can then plan health and care services around this and even provide more personalised treatments. We can apply artificial intelligence or machine learning so that we have a better understanding of what the data is telling us. These insights can help us diagnose cancer quicker or tell us who is at risk of developing certain diseases before they become ill. By working with our new systems, together we can improve the services we offer and the lives of everyone. We can keep you safer and give you more choice. We can make more digital options available for those who want them and provide support for those who can't access digital services. We can support our staff and make more information available immediately to help them care for you.
So where are we heading and where can industry partners help? So we are moving at a rate of knots. Clearly, we've heard throughout my update and from Tom's update earlier, artificial intelligence, robotic process automation, wearables, immersive technologies, connected communities. These are all areas that are on our roadmap for future delivery. When we are able to deliver some of those things, it'll be fantastic, but we do need to get those basic building blocks in place, hence the drive to level up across our system. How we then move towards cloud-based services and greater collaboration, not just within our region, but beyond, even internationally, if that was appropriate. But the real areas that we look to industry to help us with, because many of our challenges are not just unique to the health and care service. So can industry bring some thought leadership? Let's not try to reinvent the wheel if we don't need to. Can we look at how we develop essential infrastructure opportunities, connect our communities together? Health equality, inequality, and digital inequality are key areas of concern, but also opportunity. Machine learning, artificial intelligence, robotic process automation, all of those things are done in abundance elsewhere, but the health and care system is often a little bit late to the game. Software as a service, wearables, immersive technologies, and so on. These are all things that will become massive game changers for the future. And I hope that colleagues on this call and beyond will be able to offer some ideas and thoughts to help us going forward. So I'm going to stop there. Emma, hopefully that's covered the agenda, and I'm happy to take questions if that's appropriate. Thank you.
Thanks very much, Graham. That was brilliant. And I'm just aware that there was so much information on your slides. I'm wondering if you'd be happy to share them afterwards.
Absolutely,
fantastic.
no problem.
As ever with my events, we are cantering through the minutes, and still lots to deliver. So I'll pick up the questions at the end and feed them back to Graham, and we'll move on to our next speaker. So next up, we've got Mark David. He is from the North East Satellite Application Centre for Excellence, and he's going to be talking about the opportunities that there are for the health tech space with space technology. So over to you, Mark.
Thank you. Apologies. Taskbar was over share slideshow. Thank you. Thanks, Emma, and thanks for the invite. Just check everyone can see that screen now. Great stuff. Thank you. Yeah, so I don't think many of you heard about North East Satellite Application Centre of Excellence or know what we do. So I thought today the main real focus of this is just give you the insight of who we are and what we're currently doing. What do we mean by space technology? And it's not going to be lots of boring slides about space. I'll just touch on it very briefly, just really to whet the appetite, and maybe some bells ringing in heads thinking, oh yeah, we could look at that. And then also just to cover one particular opportunity that we can highlight just to show what's going on in the space sector. So as you can see from the screen, I work for Durham County Council. So the Centre of Excellence, part of it comes in via the Space Catapult. So that is located at Net Park, and a large part of my job as innovation manager is to work for the Centre of Excellence to develop that space cluster within the North East. So it's based at Net Park. Part of the recent developments at the Centre of Excellence is the Catapult have funded a physical space called the Space Enterprise Lab, which is the SAL on your screen. So the Space Enterprise Lab is a physical space. It's a room with lots of nice shiny technology that got delivered last week. We're obviously tasked with engaging in the space sector. And the North East has a real strong space sector, and one of the first, we're quite new compared to obviously NHS and the health sector. One of the first jobs I really wanted to carry out and was tasked to do when I first joined was to carry out a study on who's in the region, what expertise and skills do we have. So we produced this space directory. There's a real combination of skills within the region. It's exciting. We're actually one of the fastest growing space sector regions in the UK, which is which is something we should shout from the rooftops a bit louder. So with the Space Enterprise Lab, we're looking to bring in partners, companies, or different organisations, and use that space to develop and see how we can integrate space technology into key sectors like the health sector. To kind of compound the overall national, I suppose, attitude to space, on Monday the space sector strategy was produced, and that was, I've got a link there, so it's a 42-page document. Feel free to have a read of it. But it is, for me involved in the sector, it's incredibly exciting. There's lots and lots of investment plans, especially around health as well. So yeah, and we were lucky enough to have Secretary of State for Science, Technology and Space, Bill Freeman, visit the Space Enterprise Lab. That was our first meeting there last Friday. So it's obviously something very much at the forefront of the government's mind. So health, what are we doing? Again, it's kind of new to us for the space sector. We've very much started the journey. We've been looking at the space, the health sector for a year or two now, and it's just really, and this is why I'm here today. The information already given by speakers before is really key for me. So I need to find out the priorities and how we can integrate space technology to develop some real good solutions. So, you know, we're working with partners already, NHS trusts, AHSNs, and obviously the businesses out there. We have got the Space Enterprise Lab. We are looking at developing and putting on sprint sessions and collaborative events. Long-term plans and part of the National Task Force Healthy Living Lab programme. And this is something we are looking to replicate at Net Park in the next 2 to 3 years. And that's due to be hopefully signed off. So that's really just an idea of what our plans are. It's very early stages, but it's something we have identified as a key development. So what do we mean by space technologies? Obviously, what I've got on the screen is not the be all and end. It's not everything. I've left out key things, but these 3 things here will be perhaps the 3 obvious ones that people will think, oh yeah, that's space. So you've got the SATCOMs. So if we think about rural care, if we think about care in the communities, SATCOMs would really be very important. Earth observation, SAT-EO. So if you think about your pictures and the weather, so your pictures from space onto Earth, or perhaps pollution in the sea or air pollution, this is where EO really comes to the forefront. Then, you know, your basic, your GNSS, sat-nav, and you think about trackability, traceability of vehicles, of goods, and that you can see very important moving forward in the new models that we have for the NHS. Now, they're just 3. There's a number of other things that we can talk about, but today I just wanted to highlight what we actually mean by space technology. There are ideas of where that can be developed. As I say, the track and trace. We're looking at embarking on a pilot for drones, delivery of medicines, delivery of blood, improvement in patients' reach. You can read there, diagnostic testing. And also with Earth observation, the very last one, we can now start looking at net zero air quality, and that technology can make that process a lot easier. So this one particular initiative, and it is just one, there's a number of others. There's open calls, there's lots of different focus being put on the health sector, and these are opportunities usually by the UK Space Agency or the European Space Agency, who we work very closely with. So this one, we've developed a real strong key relationship with NHS Hampshire. and they are forerunners in the NHS Future Hospital Initiative. So a smart hospital, in layman's terms, is going to be built in Hampshire. And the innovation team at that NHS trust are looking at integrating space technology to be heavily involved in the building of this and running of this hospital. So we're looking, we have already engaged with local space sector businesses, businesses outside of the space sector who see it as an opportunity. So I think in my call today is we just want to talk. I want to have conversations with partners, organisations, companies, whoever. If you feel that the space sector could offer opportunities, then we're all ears. I'll leave my email address. I will send Emma this presentation, especially for the links there, and also my contact details. So feel free, drop me a line, and hopefully that wasn't too long, Emma.
Thanks, Mark. Fantastic.
Thank
I'm
you.
just wondering if you can drop a link to the opportunity that you've just had up on the screen into the chat. That would be great.
Yeah.
Fabulous. Okay, we will, thank you very much, Mark. We will move on to Dr. Kirsty Yates, who is joining us from County Durham and Darlington NHS Trust to share a live opportunity with you all that we've been promoting recently, and just to talk a little bit more detail about that. Kirsty, if you're there, you've got your slides up. Go ahead.
Brilliant.
Welcome.
Thank you, Emma. My internet connection is saying it's unstable, so if I freeze, I hope it's on a smiley face. Okay, thank you very much. I'm really pleased to be able to present what I think is an exciting opportunity for SMEs to work with County Durham and Darlington Foundation Trust and also the Academic Health Science Network in developing a digital and interactive feedback tool for children and young people in healthcare. So just to give you a bit of background about myself, I've been a children's doctor for over 22 years, and for the last decade I've been specialising in child neurodevelopment. I think somebody else must be sharing my slides, so can I have the next slide, please? Thanks. So I'm employed by County Durham and Darlington Foundation Trust, which is a large hospital trust delivering healthcare to over 600,000 people. 20% of that population is children and young people. In my clinical role, I see children with a range of needs, abilities, and also disabilities. And this slide just shows you the variance. So I could be looking after a little baby that's been born extremely prematurely, but needs developmental follow-up because they're at risk of developing cerebral palsy. I could be looking after a young person who has learning disability and autism spectrum condition, genetic conditions such as Down syndrome. We could look after children with hearing or visual impairment, and also children who are in the foster care system, or more recently, unaccompanied asylum-seeking children and young people. So there's a range of needs, abilities. What they all have in common, though, is that each of these young people and children have views and perspectives. And we've heard the word many times already this morning. They are our future citizens. Next slide, thanks. So what's important to me as a clinician and also as the clinical lead of our team and the organisation CDDFT is that we're delivering high quality care to patients. We know that that improves long-term outcomes for health, well-being and population health as a whole. But what's key to delivering that high quality care is understanding patient experience, which we've already heard about this morning. And to do that, we need to get feedback from patients. But this isn't just a one-way system, because actually children and young people through many forums say they want to be heard, but sometimes their views are really not being captured in a robust way. And whilst we have methods available to us in the trust, Given the area of work that I do, I think there are some limitations, and certainly they don't appear to be engaging or inclusive enough. So just to give some examples, we may get anecdotal parental feedback at the end of an appointment, but we're not able to capture that. We have feedback cards in outpatients. We have the family and friends test that goes out, but actually there's generally a low return. There's also a bit more of a focus on inpatient settings rather than outpatient settings, and the service that I work in is predominantly outpatients. We've also moved to virtual consultations, so patients don't always hit a hospital site. I think we also have to remember that children's views and young people's views are not always the same as their parents, but the methods that we currently have tend to be focused towards the parental view. And something that I feel really quite strongly about is that a lot of the methods exclude those children and young people who have additional needs and disabilities. And that's where the digital equity comes in. Next slide, thanks. So having described what the problem is, what we need is really a system to be able to capture the voice and the experiences of children and young people who are accessing healthcare services within our organisation, because that will allow us to listen to and understand their views. It will help us shape and develop future services to meet the needs of the population. We are in a situation where we do have to evidence value of our service to commissioners. So knowing that we're doing a good job and providing high quality care is really important. If we're doing well, then actually that's really important to share good practice, and we do that across the integrated care system. But if we need to improve, then we need the feedback to know what we need to do better. I think the other thing that's important to workforce is to be able to provide feedback to staff, both when they need to improve, but also if they're doing a good job. It's so important to morale and to feeling valued as a member of the NHS. And finally, from an efficiency point of view, it's to reduce the was not brought. So we use was not brought in paediatrics because they can't drive or bring themselves. So it's the equivalent of the DNA. But that has a really costly effect to the NHS. And we know that was not brought are linked to experience of healthcare. So if we get the experience right, that should in turn reduce the was not brought. Next slide. So when I was thinking about this problem and what we needed to do, I started off where I should have started off, which is actually getting the views of children and young people on what they think a feedback system should look like, what they would want it to have or not have. So back in 2019, pre-pandemic, I held a focus group with some children and young people from Investing in Children in Durham, which is a children's human rights organisation that has input from children who have chronic health conditions, children who have experienced foster care, and also children with special educational needs and disabilities. And that was a really good session because what they told me is what they want is something that's really fun. They want it to be interactive. They don't want it to rely heavily on words. They want it to be visually appealing, with pictures that help them understand what the questions are. They want it to be anonymous, but they want also to have the option of being able to leave more feedback. And then they want it to be safe as well. They said it needs to be a safe system. What they didn't want was lots of questions and long surveys, which I know are around. They want it to be quick and easy, less than 3 minutes to give their response. And they want their response to be meaningful. So they want it, they don't want somebody to be able to change that or skew the data. So just to give you an example, there are the feedback systems that you have at the airports with the buttons about what your experience is like. Something like that is quick and easy, but actually you might have a young person that particularly likes the colour red, for example, or particularly likes repeatedly pressing buttons if they have an autism spectrum condition, just as one example. So they might repeatedly press that button that would interfere with the response. So children and young people are very clear that what they want to tell us has to be meaningful and that we take it as such. Next slide, thanks. So to pull that together with both children and young people's views and what we would want from an NHS provider organisation, and to make it different from what we currently have, the system criteria that we need to develop, it's got to be something that engages children and young people from a physical perspective. In an outpatient setting or an inpatient setting, it's got to grab their attention, and it's got to be fun, and it's got to be interactive. Given my perspective, we've got to be able to have responses that can adapt not just to the chronological age of a child, but their developmental stage. So, for example, there, I might look after a small child who is age 5, but if they have autism spectrum condition, they might have the verbal abilities of an 18-month-old child. So it's being able to not just categorise feedback according to age, but having adaptations to their developmental abilities. And that really means being inclusive for children and young people that have additional needs, such as motor impairments, hearing or vision impairments, communication difficulties. What we need as a trust is something that is customisable to the different departments. So we might have a shared clinical area where I might be consulting alongside a paediatric orthopaedic doctor or a general surgeon. And as clinical lead of my team, I want to know how our part of the service is doing. And likewise, those consultant colleagues would want to be knowing how they're doing. So we would need to be able to customise the questions or what we're trying to focus on in terms of feedback to our particular service area. And be able to adapt and change that ourselves. And that also includes the ability to ask the family and friends test, which is a mandatory requirement of a trust. I've said before that a lot of the feedback system that we have is targeted towards inpatient settings, but we would need something that's adaptable both for outpatients, inpatients and remote consultations as well. Again, sort of leading on from what I was saying as a clinical lead and understanding the information coming to me as clinical lead to develop services, we would need to have functionality within the system to both collate and disaggregate the responses. And in prototype development, that would have to be a standalone IT system because of all the governance and red tape that surrounds NHS digital. The other thought that came from children and young people was having a character or a mascot within the design that will help contribute to the identity of the system and the interactivity, make it more fun. And I won't go into detail about Sprout, but those that have seen the briefing paper can refer to that to have a look at an idea. But ultimately, the key to this is that any system needs to be co-produced with children and young people from the outset, really, so that we can get it right. Next slide. So in terms of next steps, the briefing has gone out and we are seeking expressions of interest from an enthusiastic industry partner to work with us on this. The closing date is the 8th of October. And the plan is that we will have short pitches to a small panel on the 13th of October. We've been able to secure some initial funding through County Durham and Darlington Foundation Trust Charities, which is just over £3,000. The expectation is that any prototype developed would need to go through a research evaluation, and we've got good links with colleagues in the Academic Health Science Network to be able to help us be able to do that. And then ongoing funding for further research evaluation and product development, again, would be supported by the AHSN through a variety of funding calls. I don't know whether there are any questions. I'm happy to take them offline. You've got my email. But before I stop, I just really want to acknowledge Emma for giving me the airtime, and also colleagues in CDDFT Research and Innovation, the CDDFT charities, and also Academic Health Science Network for their support to date. Thanks.
Thanks, Kirsty. If I can ask people to hold off on questions, I will circulate Kirsty's contact details, and if anybody hasn't had the brief that would like the brief, then please let me know. Those expressions of interest need to come through me before the 8th, but I send around that information again. we are going to have to gallop off. I keep making horse references, I don't know why. Onto the next presentation, something completely different now from Andy Morrison, who is joining us from the Great North Air Ambulance Service, just to share a bit of a case study about how they harness innovative technology within their charity. So Andy, over to you.
Morning, Emma, everybody. I'll just try and share my screen. How's that looking?
Yep, we can see it.
Are we on? Thanks. Just in view of the time, Emma and everybody else, I'll sort of whiz through introductions. Thanks for having me. My name's Andy Morrison. I'm the Director of Ops at the Great North Air Ambulance Service. I need to check with Graham, who owns the copyright for Great North. I've noticed that bandied around quite a lot this morning, so we need to just be clear on who owns the Great North copyright for the care records. But yeah, Director of Operations and by trade an aircrew paramedic. Very quickly, we are a pre-hospital critical care service, and we operate from Yorkshire to Scotland, coast to coast, by air or by land, essentially delivering ED level critical care to the roadside at the point of injury. We've got aircraft based just near Middlesbrough and just outside of Penrith, and response cars at both those bases as well. Aspirationally, we want our service to be available to our communities 24/7, and we're making progress on that currently. What's unique about our operating area is not only the size, it's 9,000 square miles, which is the largest charitable air ambulance patch in the UK, but also the diversity of our operations as well. So as well as seeing lots of kind of urban violent crime at night, we can be on the coastlines with people who've drowned, doing heavy industrial accidents, but also as well in the beautiful Lake District in Cumbria. So some of the context around that this year with the staycations, the tourism in Cumbria has been off the map, and with that brings obviously that the higher volume of people in there, the more people there are to fall off things, injure themselves, or even have medical events in very remote areas. Hopefully this will provide a bit of context around what our operation in the Lake District looks like. And there's a couple of things I just want to sort of bring your attention to. One is how closely we work with mountain rescue teams, but two is also just the terrain itself. And in this particular scene, we've been able to land the aircraft in a relatively flat area, of which there are few in the mountains in Cumbria, and the patient has had to be brought to the medical crew. And that's really the fundamental reason why we believe there's a way of doing this better. I just want to draw reference to some of the people that have spoken before me. What everyone has in common is a desire to improve what's currently happening, and that's really where we're at. But where we've looked at big systems, certainly Graham's piece around sort of digital integration, Mark's aspirations for technology using satellites, and Kirsty and their impact on a wide number of kids. What we're really talking about here is individual patient impact. And if I can, just this sort of picture on the left-hand side of the screen, this gives a little bit more context around sometimes how remote the aircraft might be. And at the minute, if you have a critical injury or illness in the mountains in Cumbria, then we are your best chance. Our aircraft can be in the air within 3 or 4 minutes, and it can be on the mountaintop in 20-25 minutes. But still, it might take a while for our crew to get there on foot. As you can see, again, from some of the pictures, flat areas are difficult to find. And so The mountain rescue teams themselves have been incredibly busy this year, and last they're dealing with 450 to 600 call-outs annually. And what we see in the mountains are a combination of either rescue requirements, medical requirements, or both. So we work very closely with search and rescue aircraft if there's access issues, but all of this takes time. And although we are your best chance, if somebody has a heart attack and suffers a cardiac arrest in the mountains, then it's almost, dare I say, futile. It's pretty harrowing as we're orbiting the scene of somebody that's collapsed and is in cardiac arrest to see their loved ones or bystanders desperately trying to deliver CPR in the absence of defibrillation and any other medical equipment. So from a technological point of view, I believe that there may be an answer in either harnessing the next generation of aviation equipment or the jet suit itself. Some of you may or may not be familiar with Gravity Industries. They're a UK-based company, and they've designed this essentially 5 turbines that are worn by the pilot that is incredibly effective in getting you up the side of a mountain. What can we do with a jet suit equipped paramedic? We can actually do an awful lot. So those critical care cases that I was talking to, with relatively small amount of medical kit, and we're talking about 15 kilograms, we can control catastrophic hemorrhage, we can manage immediate airway needs, we can provide advanced life support, and also critically support and information for incoming aircraft and mountain rescue team members. Over and above that, as a charity, our aircraft are expensive to operate, and so we have to be very specific in the cases that we deploy it to. By having a more cost-effective way of getting to patients on the hills, it means we can extend our area of and our scope of operation into less serious cases, but still from the patient's perspective, very important. If you break an ankle on the top of Helvellyn, not only is it quite a frightening experience, but also very painful as well. And even with the heroic events, the heroic response by the mountain rescue team, it still may take somebody an hour and a half to get to you. And that's a long time to be scared and in pain. So our question is really, can we use this and harness this new technology to improve our access to patients? What we did, I'm going to just very quickly try and get a remote control and a date pause. No. Can you see my cursor, Emma?
Yes,
Yeah,
I can.
that's a nod. Great. So if anyone's ever had the pleasure to walk on this incredible piece of mountain, it's called the Band. It's in the Langdale area of the Lake District. It's really a really popular spot for walking. But what we designed was a proof of concept exercise. So we deployed a blue light vehicle with a jet suit in the back of it to the top, to the bottom of the hill, and parked it where I'm indicating by the cursor. And we had a simulated casualty up in the crags. We worked with Mountain Rescue to test our response against theirs, and they conducted their walk in about 25 minutes up the Band. The jet suit took 90 seconds. If anyone's seen the footage, one of the things that we want to really reinforce with all of this is safety. So the redundancy of the suit, Gravity have been flying them now for 4 or 5 years. The technology has got better and better, but the way that you would operate the equipment is very low to the ground at very, very slow speeds, but these are exponentially more effective than walking. So if there was an issue with the technology or one of the engines, then yes, the operator would come down to the ground, but it would be done from 3 or 4 feet, akin to kind of coming off a mountain bike is what we're trying to, liken it to. And by the very nature of these environments, they are hostile. Even getting out of a helicopter on uneven ground, carrying heavy kit bags, exposes us to a level of risk. In terms of the model of operation, what we can do in the Lake District, what you're seeing here is an aviation map of
Has Andy just frozen for me or for everybody?
Me.
Frozen here as well.
Yeah, frozen here.
Oh, hang on. Could be coming back. The screen's gone blank. I'll give him another second. Okay. Claire, are we able to take Andy's slides off? It seems like he's disappeared, unfortunately. Very good. Okay, hopefully we can get him back. So before we go on to introduce Joe, as you've probably noticed, we are now at 11:25. So over to you on what you'd like to do. I'm really keen to get your feedback on your thoughts on the cluster where we go forward next. So please, everybody, if you wouldn't mind filling in the survey, what would you like to do? We can extend the meeting if people are available. We can schedule an additional hour potentially in the next week or so to get direct feedback from you guys. Or we can send around a short survey and gather your feedback that way. So really interested in how you would like to do that. So you can keep voting while Joe gives us a little overview of the new Ignite program that's come into the region. Over to you, Joe.
Great, I get to follow the life-saving jetpack.
Sorry about that.
That's fine. Hi, everybody. Well, first of all, congratulations on your first year. It sounds like there's so much hard work being done, and I understand lots of stuff gets done behind the scenes and we're not always aware of it. So happy to see that stuff has been happening. For those of you that don't know me, I've been involved in like the startup tech scene of Newcastle for quite a few years. I used to run a web agency, and then I was on the program with Ignite in 2013. And at that point, I think we learned more in the first 3 weeks of being on Ignite than I did in 7 years of running a web agency. This has made me a huge fan of the Ignite program. So I was really excited knowing that it was coming back to the Northeast as part of the North of Tyne Combined Authority. So for those of you that don't know what an accelerator is, it's basically a mixture, or this is how we do it, a mixture of mentors, introducing people to mentors, introducing them to investors, workshops, and delivering harsh truths in a soft, supportive environment so that people can make better businesses that are more likely to succeed. And I've benefited from this, particularly from my last startup where we exited just before Christmas. We're going to be here for the next 3 years. And what I'm really keen to do is to speak to as many people in the ecosystem as possible to find out how we can help each other. How can I help everybody else with their goals? Because we have the same agenda. How do we create lots of really cool tech, which is also making a difference in people's lives? I'd like to speak to as many founders as possible, or as many people with ideas. I'm really, really keen to try and get people that are maybe not in tech, starting tech businesses. You don't have to be a developer. You can raise an investment and you can hire them. But what you do need to have is an interesting idea that's going to have a meaningful impact on people's lives. So I'm very interested to speak to everybody from people with just an idea to maybe some people that have some tech, but it's not maybe commercially proven. The first program that we're going to run is in January, and it is a pre-accelerator. So it's very, very early stage ideas, but we will be having programs over the next 3 years, as I've said. So if I understand what the needs are, there might be a need for, a tech cluster program where we can 100% focus on those, or maybe something with a different focus for more advanced businesses that have maybe raised some investment but are looking to raise a couple of million, which has been traditionally very hard within the Northeast. I'm also really keen to hear, as I said, from people that might be mentors, so other founders or other people that have expertise. If I know where to point people for advice, that would be really, really useful. We don't have all of the details of the pre-accelerator, but what I can tell you is that it will follow the format that's worked really, really well in Northern Ireland for the last 3 years, which is 5 months. We don't take in equity at all, but there is a grant of 10K per team. We think it's really important that we don't take any equity, so that teams can make the decision of whether they want to be investable or not. And also they need all of that equity to be able to negotiate valuations. So yeah, so it's essentially free money. And as I said, it's a mixture of mentoring and connections. We're all ex-founders, so we understand everything from big picture to the nitty gritty. And when I've been entrepreneur in residence with the Northern Irish teams, I've done everything from founder counselling to discussing IP to actually like going through and fixing little bits of code to messages. So we're all very, very hands-on, and we're here to help. We also, because we've been involved in startups ourselves, have our own networks. So a lot of the workshops that we have are from people working in startups, doing this job every day around the world. We've got friends in Silicon Valley and Boston, and we do absolutely leverage all of that network for the good of the teams within the actual program. I think that's the bulk of it. I want to be as quick as possible, but I'm here to answer questions. I'll send a link. You can book anybody can book 20 minutes with me, and I can either run through and give like a little mentoring session. I will use my network wherever I can, and as I said, I'm also keen to speak to other partners and see how we can support each other in all of this brilliant stuff that's happening around the region.
Thank you, Jo, and thank you for finishing spot on time. Thank you very much. I'm going to share the results of the poll. You should be able to see that now. So it's a fairly even split of what people want to do. So what I would recommend is, I'm going to say at this point, thank you very much for coming. Anybody that doesn't want to stick around, I hope you've learned something, gained something, found an opportunity that you might be interested in, and happy for you to get in touch directly with me if you want to reach out to any of the speakers. I will extend the meeting for another half an hour for those who want to stay, because I'm really keen to get that feedback, but we will also probably do all of those things on the poll, seeing as it's such an even split, to get feedback from as many people as possible. So anybody who would like to go, farewell, have a great day,